Let me turn to Kate Tulenko. She's founder and CEO of Corvus Health, a global health firm. Dr. Tulenko, thanks for being with us. How concerned are you about the CDC findings? What does it mean for those of us who are vaccinated and those who are not?
What's bad news for both groups? For people who are vaccinated, the vaccine does protect 90% from severe illness, but you can still get it and you can still spread it to others. For people who are unvaccinated, we have to remember that the vast majority of unvaccinated people in the US are unvaccinated by choice. So those people also probably are not masking, probably are not social distancing as much as they should. So they're at greater risk both of getting the Delta variant and then falling ill from it. So it is a concern. We are seeing some hospitals fill up again, particularly in areas where there's not a great deal of masking. And today, the Texas governor put out an executive order forbidding local jurisdictions to do mask mandates or to limit capacity of businesses.
Would we be at this juncture, Dr. Tulenko, if the majority of Americans were vaccinated?
No, we would not. We would be in a much safer, much better position. In fact, you wouldn't see most of this transmission. You wouldn't see most of the hospitalizations and deaths if more Americans had been vaccinated. If you look at countries like Israel, Malta, Argentina that have vaccinated Chile, large proportions of their population, you're not seeing as much spread as you're seeing in the U.S.
So where do you think things are headed down the road in the next few weeks, next few months? Right now, even for those of us who are vaccinated, wearing masks indoor is a guideline at this point. Are we going to see that become a mandate again?
Well, it may be a mandate again. Unfortunately, it's become political. But I think what we can predict is we know that many school systems are going to open up in 3 or 4 weeks, in late August and September. So children will start spreading it. In Texas, schools cannot require kids to wear masks or social distance. So we're going to see a great deal of spread there. I do think we're going to enter a cycle very similar to the flu, the annual flu, where people will need boosters every year. In fact, Israel has started to give COVID boosters to the older people that got the vaccine in the first round.
Are we going to see that in this country?
I think we will. My guess is that within the next 4 to 6 months, high-risk people will be offered a booster, and in fact, perhaps everyone will be offered a booster. I also think that by Thanksgiving, kids 6 and up will be able to get the Pfizer vaccine.
So, Dr. Tulenko, if I, for example, got the Moderna vaccine, I'm fully vaccinated, if the booster is offered by Pfizer, is it safe to get the Pfizer booster shot as your third inoculation?
It is. In fact, in Europe, they've been doing a lot of this mixing of vaccinations. In fact, Angela Merkel, the Chancellor of Germany, got one vaccine for her first one and a different vaccine for the second one. So it is completely safe.
Dr. Tulenko, what is your message to people, a lot of them who are still hesitant to get vaccinated?
I would say talk to your physician, think about the vulnerable people in your life, and make a decision that's good for you and good for the other people in your life.